Well, we predicted Red Sox victory way back in April, and here they are, world champions. Maybe people should listen to our healthcare predictions too.
David, we always predict the Red Sox are going to win.
Welcome to CareTalk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Well, John, we still live in a democracy, and we're thankful for that because it meant we had midterm elections earlier this month. Any big takeaways on the healthcare front?
Well, I think this is the most consequential election for healthcare in America's history. If you look at the combination of the huge swing of congressional seats to the Democrats, what issues were they running on? Healthcare coverage, loss of pre-existing conditions, Medicaid and Medicare. If you look at the states, blue states turning purple or blue in voting for Medicaid expansion, states like Nebraska and Utah, I think we've redefined the terms. Indeed, glad that you're still focused on your key constituency in Boise. I think this has redefined the middle in healthcare. And what's interesting is that the Republicans chose this issue as the defining battle line, and they picked the wrong one. It got so pathetic that the Republican candidates were claiming their credibility on healthcare issue was reinforced by the fact that some of their relatives episodically got sick. I mean, this is redefined healthcare in politics, and I think is done it for a generation. Nothing has been more supportive of Obamacare than Trump's and Mitch McConnell's attacks on it.
You know, I think you got healthcare on the brain, John. You're in healthcare, so you talk about healthcare. I think, you know how they said it's the economy stupid? It's Trump stupid. People are voting against Trump.
No.
And what did the Democrats have to say? Sure, they wanted to say something other than, yeah, we're just against Trump. Oh, healthcare. You know, people don't care about pre-existing conditions.
They do.
What do they know about that really anyway?
Everyone, one out of every 3 or 1 out of every 5 families has a pre-existing condition. There's some argument about how many. It's growing every day.
Well, John, in Montana, which you didn't mention, mention Idaho. You can't mention Idaho without Montana. So Montana you should not. Montana actually had a Medicaid expansion, and they did the right thing, and they said, let's check it out after a couple of years. If we want to continue working on it, we will have the voters decide. And you know what they decided? They decided no.
I think what you're missing is the broad brush across the country. If you look at all of those congressional elections, there wasn't one Democrat who won against a Republican in a new race, a newly elected Democrat, that didn't make healthcare the center. And that's the largest swing since Watergate. If you look at the broad brush of the majority of states, Democrats aren't going to win everything. Healthcare's been redefined. Healthcare matters. You're wrong.
Oh, boy. All right. What else you got for me, John?
Well, maybe we sort of dial it back a little bit and have you explain why you're such a critic of the Medicare Advantage supplemental benefit ads. First explain it and then explain why you're against it.
All right, John. So Medicare Advantage is a form of managed care for people in Medicare. Now they have to trade off the
Medicare, the
program for people 65 and over and the disabled. Yeah. So in Medicare, usually you just choose your doctor. There's none of these managed care restrictions. A lot of people move on to Medicare Advantage because they think it's going to be better for them and they're going to be able to get some extra benefits.
Do you know what that is? The whole Medicare Advantage thing?
The advantage of Advantage?
Yeah. Do you know what that is?
I guess we'll find out. So one of the things that they're doing in Medicare Advantage is they have more freedom now to offer supplemental benefits. Things like transportation to the doctor, nicotine replacement therapy, respite care for
in case you run out of things to mention.
Yeah.
It's actually pretty broad.
It is.
Medicare Advantage is the HMO-like option for Medicare eligibles. Yeah. Where the private sector is helping manage that care on a budget, but also adding supplemental benefits. This is a radical opening for what those supplemental benefits might be. And rather than kind of throwing kind of a Silver Sneakers gym membership at people or another set of eyeglasses, it's redefining the kinds of investments Medicare Advantage plans can make to make sure that people can get access to care and stay healthy. And it doesn't seem like you can either explain it.
Yeah.
If you can't explain it, you can't appreciate it.
Haranguing me, deal. So here's the thing, John. Medicare, regular Medicare, traditional Medicare is I go to which doctor I want. I go to which hospital I want. I can do what I want and don't have the government or some managed care company interfering with me. Now the idea is, okay, so it's a giveaway to the private industry, the insurance companies, and the government says, you know what, you can also toss these other goodies out here. And chances are, like prevention, it doesn't really pay off. People like to have that membership.
I suppose now you're against prevention, so don't take your flu shot.
I don't think
come on, stop.
I don't think it pays for itself.
The reality is most doctors are now part of those Medicare Advantage plans. They offer broad choice. They are increasingly popular across every age and income
Was it a popularity contest? That's how we're measuring it now?
And the results for fee-for-service Medicare are we spend more and get less. And by the way, in fee-for-service Medicare, Medicare beneficiaries are paying a lot out of pocket. I think what's exciting about the supplemental benefits, which really are benefits that are not traditional healthcare benefits that can keep you healthy, are going to allow sort of a positive experiment to invest in things like food, housing, and transportation that are essential, particularly for poor and vulnerable people, to get care. You're too much of a skeptic of HMOs. They're popular. We won on that. And now you're starting to see, I think, an expansion of what those plans can do. And really, we'll see. I think the golden age of Medicare Advantage is upon us.
We will see, John. We will see if it's gold or if it's actually more tarnished, which is what I expect. What else?
So, David, you've been a big supporter of this administration.
Absolutely.
And I want to know what your take is of the fact that we're now proposing to use global pricing to help reduce the ridiculously high price that American consumers pay for drugs today.
So, John, I think that this is actually a genius plan, and it's being the idea is
genius?
To take genius,
it's
like
really pretty simple.
Stable genius, John, like Mr. Ed, the talking horse, came up with it. Okay, here's what it is: for a narrow sliver of drugs, which are these expensive drugs administered in physician offices, they're going to
this narrow sliver that is the most expensive and the fastest growing.
It is. So something needs to be done about it, right? So what they're going to do is they're going to say, instead of saying, "Hey, there's all these freeloaders that are out there. Let's actually freeload on these other countries like
that's
Greece."
That's called a market solution.
It's not a market. That's no. It's the freeloaders. They're going to go in and they're going to say, "Let's take the Greek price. Let's let the Greeks negotiate the price and do the analysis, and then we'll use that price." What's actually good about it, John, is it will scare the heck out of the pharma companies. Am I allowed to say that word on the air? And what it will do is, instead of the pharma companies going and saying, "You know what? I'll give it to Greece. You know, they don't have any money. They're little.
Would you
we'll actually
rather
crank
pay
up the price for Greece because it's going to affect my price in the U.S.
Why should the U.S. consumer pay more than the Greek, the French, the German, the Ukrainian, the Swedish, the Norwegian?
Because we're number one.
Why? No, we're number one in cost. Not necessarily, we get no other benefit. It's the same drug. I think it's a really good proposal. I'm not sure it's genius.
I thought it was a good proposal. What's the disagreement?
There's no genius here. It's just a sensible market-based solution. Let's see if
it's not a market-based solution, John. It's a big government
market price. No,
come on, the European market.
We have a big government solution. Big government in the U.S. pays whatever price pharma asks, and other countries negotiate. We're just simply doing the right thing. I think it's a good idea.
All right. So, John, since you're such a big fan of government action, I bet you're a big fan of the FDA going and telling people what they can inhale. Is that right? With this new vaping regulation?
There's no question.
Mr. Free Market.
That's a good idea.
Okay.
And first of all, the whole purpose of the Federal Drug Administration is safety, and of the food supply and pharmaceuticals and the safety of the country. Public health really matters. We know that nicotine addiction and nicotine toxicity is one of the most expensive things we pay for in healthcare, one of the most toxic things we can ingest in our system, and is highly addictive.
Yeah, but John, the e-cigarettes help people. They help adult smokers to quit. That's the argument.
No. That's
let
total
the free market decide.
BS, and we can say that too. That's and the FDA commissioner is being aggressive about calling those lies out, pointing out that these are advanced delivery vehicles for poison for young children and people who are vulnerable making decisions, and they're being wrapped in taste and product and marketing that is cued to create addiction. This is not a time in American history. We know that it took about 100 years for the FDA and the federal government to get its act together to regulate tobacco. I'm really excited that we're not waiting too much time to do the right thing for the safety of the American population.
So, John, I was actually just needling you there a little bit because I actually mostly agree with you on this now, but I don't know if we agree on whether do you prefer the mango or the cucumber flavor, because what's actually happened is very insidious, is that these little Juul devices that look like USB chargers and actually actually fit into the USB port
That's
for charging.
There's a lot of vaping.
are very problematic in high school and in middle school. And I think what's happened is people have realized that this is a major crisis and are actually doing something to stop it. And I think it's great, John, that the FDA is not being managed like the EPA, because if it were
not being managed at all,
if it were, we'd probably mandate that all these devices be out there and everybody start vaping.
Let's celebrate the positives of your administration.
All right, John. Now, I don't know if lightning is going to strike, but the lightning round is. Are you ready?
I am. So, David, you always look for arguments at Thanksgiving. Did you guys talk about the family, get into it, about health care?
Well, John, Thanksgiving is a traditional time for this engage with grace, where you talk about, would you like to die?
It's about death.
Would you like to die at home? And I was going to bring
along with your parents?
I was going to bring this slide out and talk about it. And then my brother took the last part of the stuffing. I said, "You're going to die at home right now, brother." How about you, John?
Weak. Nope. We just talked about sports.
Probably better. Will the Supreme Court overturn Roe v. Wade?
Well, it might. I mean, clearly there's been a move to a conservative court. The fear is that it will.
John, there's a lot of the protections of Roe v. Wade have been lost at the state level, and maybe even worse is the Supreme Court is upholding some of those changes. So I'm not sure if the demise of Roe v. Wade would make as big of a difference as people think.
But it would be good to have at least a clear conversation about the choices. But let's not leave it up to the courts. It should be a political conversation. So, David, I see you've upgraded your plastic watch from the $10 watch you usually wear to maybe a $100 Apple Watch that doesn't really matter.
John, it's not $100. It's a $400 watch.
Oh,
and the thing is, well, it's a great fitness tracker. You know what?
Casio kept great time.
It sets my. I was going to wear it on the other wrist, but it sets my fitness goal so low, John, that I can meet my goal and close my rings just sitting here yammering with you.
Waste of money.
How about them Red Sox?
Oh, David, the Red Sox again. Of course they won. Most expensive payroll, great coaching, great end to the season. Please take off the hat.
John, you know what? The Red Sox are like the U.S. healthcare system should be. Sure, it's going to be the most expensive, but it also should be fun. It should be entertaining.
There's nothing entertaining.
It should be well managed. I will, unlike Ted Williams, who's not my uncle, I will doff my cap, John.
No. Al, you can't compare the management of the Red Sox, which is outstanding, to the management of healthcare, which is a disaster.
That's how it should be. All right.
Bad.
Well, that's it for another edition of CareTalk. If you like what you heard, make sure to subscribe using your favorite service. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for joining us.